The following video contains information regarding depression and suicide. I want you to sit back and imagine the number of times you must have heard the word depression in the past couple of days. You probably came across it on social media, in casual conversation, or it just popped into your head while you were trying to describe a situation or a feeling. Since the word depression is so commonplace, you might assume that you understand it. Today, I'd ask you to think otherwise. What is depression? Generally, the word depression refers to feeling low, sad, fed up, or miserable. It is an emotion that almost everyone suffers from at some time in their life. This term depression in itself does not refer to an illness or a mental disorder. However, the persistence of depressive symptoms such as feelings of sadness, guilt, or tiredness without any physical exertion might indicate the presence of a depressive disorder requiring treatment. When these symptoms start to interfere with a person's everyday life and last for at least 2 weeks, the person might be assumed to be suffering from major depressive disorder, or what we commonly know as clinical depression. Even though depression is one of the most common mental disorders, no two people experience it in the same manner. Psychiatric diagnostic systems classify depression into different types of depressive disorders, and there is no common cause identified for them. Several scientific theories link depression to brain volume, brain chemistry, neuroplasticity, and even our immune system. What is it like to experience depression? Depression manifests itself in every aspect of a person's functioning. It negatively affects the way a person feels physically and emotionally, as well as their thoughts and behavior. A depressed person might feel weak and tired, experience vague aches and pains all over their body, and wake up feeling exhausted. People who are severely depressed may also experience psychomotor retardation. That is, their speech, thoughts, and movements slow down despite their best efforts. They might find general everyday tasks to be overwhelming and dread getting out of the bed. They're not lazy or slow, but experiencing distress, and giving common advice such as to think positive thoughts or go out in the sun may even cause more harm. Another way depression hampers a person's life is by affecting the way they think. A depressed person responds differently to everyday life events and stressors. Any small piece of unpleasant information can cause overwhelming feelings of guilt and sadness. These are accompanied by excessive and repetitive negative thoughts. For example, getting a low grade on a test may drive a person to thoughts of worthlessness, pessimistic ideas about their career, or even the utility of their existence. While these thoughts may not have a firm logical basis, a depressed person struggles to break loose of them. The emotions accompanying these thoughts can be so overpowering that the person might shut themselves out from their immediate environment, which in turn can increase the occurrence of these thoughts and emotions. Not only do these thought processes affect a person's behavior, but also the way they form new memories and recall old memories, the way they pay attention to different stimuli in the environment, and their decision making abilities. The hopelessness and misery brought about by depressive feelings and thoughts often results in suicidal ideation. We all have our own perspectives about suicide influenced by culture as well as ideology. The thought of ending life is often a common response to difficult problems or frustrations we experience. For most people, these thoughts pass quickly, and the very existence of these thoughts does not indicate any mental health problem. Talking with friends, family, or any other trusted person while working out solutions to our problems usually makes these thoughts go away. However, for some people, these thoughts are persistent, resulting in thought patterns that create severe emotional disturbance and disability. These thought patterns may be associated with mental illnesses like psychosis, depression, substance abuse, or severe social and personal difficulties. Severe stress caused by sudden financial problems, loss of a loved one, or unhappy relationships may trigger the occurrence of suicidal thoughts. Counseling or even the support of a trusted person can be extremely helpful and life saving at this time. Contrary to popular belief, men are more vulnerable to suicide than women. While women are more likely to suffer from emotional distress than men, the risk of death by suicide is usually higher in men. Any such attempt indicates a heightened state of distress and should be provided with prompt help. In India, the Mental Health Act 2017 mandates presumption of severe stress in case of attempt to commit suicide. The government shall have a duty to provide treatment, care, and rehabilitation to a person having severe stress and who has attempted suicide. Seeking help. In India, there are different types of mental health professionals who might work as a team to treat patients. These include a psychiatrist, clinical psychologist, counselor, and psychiatric social worker. A psychiatrist is a medical doctor who holds an MBBS as well as an MD in psychiatry, recognized by the National Medical Commission. Only psychiatrists are qualified to prescribe psychiatric medicines and are often the first point of contact for people seeking mental health services. Both psychiatrists and clinical psychologists are qualified to provide psychological assessment and diagnosis for mental health issues. A clinical psychologist can provide psychological therapies for mental disorders, which are evidence based treatments to help persons suffering from mental disorders. They hold an MPhil in clinical psychology from any institute recognized by the Rehabilitation Council of India. It is increasingly common in hospitals for psychiatrists and clinical psychologists to treat patients as a team. Counselors are often postgraduate degree holders in psychology who can provide counseling as well as psychotherapy for mild emotional problems and distress. For depression, several combinations of treatments are available. Some people respond fairly well to antidepressants or SSRIs, which usually take 4 to 6 weeks to start showing their therapeutic effects. Contrary to popular belief, antidepressants aren't addictive and each of them may work differently for different people. To discontinue or change medication without consulting a psychiatrist is dangerous and might make the patient's symptoms even worse. 1 out of 3 people suffering from depression respond very well to cognitive behavioral therapy alone, which is a psychological therapy focusing on restructuring a depressed person's thoughts and behaviors. A combination of antidepressants and CBT is popular and often very effective treatment for depression. Other treatments available for depression include electroconvulsive therapy and transcranial magnetic stimulation. These are usually the last resort for severely depressed people who are unresponsive to medication and therapy. While ECT is associated with difficult side effects, it can be life saving for a severely depressed person and can only be administered with consent provided by either the patient or their nominated representative. The core idea is that depression is treatable. Recognizing it and seeking help as soon as possible increases the efficacy of the treatment options available. If you know someone who you think might need help, gently encourage them to do so. It can be very hard for a person to access mental health services, and one gentle nudge can save a life. Thank you.